In today's video, we're going to discuss 3 tips that you need to hear before your SLA exam. So let's get started. First tip, all case scenarios are structured the same way. Inspire Global Assessment is assessing you for your ability to practice as a safe nurse in the Canadian environment. So what does that entail for you as an IEN about to do the SLA? That means you know how to read the documents properly, you're able to figure out what are the essential information that you will need to take care of this patient during this case scenario. What does safety check means and what are you looking for when you are doing safety check? Do you know the right questions to ask your patient in a therapeutic way? Are you able to critically think through your patient's concerns, your patient's issues? And are you able to figure out what are the key nursing interventions that you need to give to this patient? Lastly, as the SLA exam is a time assessment, time management is key. Some IENs unfortunately don't even get to the medication administration or patient teaching. As they get stuck in the beginning, figure out what focus assessment or what information they need to do or what interventions. Do they need to call the doctor or do they need to give interventions right away? To prevent getting stuck, be organized, practice critical thinking skills, and prepare way ahead of your exam. Also, I'm currently working on finishing up with the IEN preparation course, and thank you for everyone who's been messaging me and following up on when it's coming out. I'm working very hard to make sure that it has all the components you'll need to be successful on your CBA and your SLA. If you're new here, I'm Ira. I'm a Canadian RN, nurse educator, and founder of nursingcollective.co. Now let's get back to the next tip. This is something that IENs forget sometimes. During your SLA, Inspire Global Assessment, and your CBA, they are assessing your current knowledge and skills against Canadian health practice and standards. So that doesn't mean you're going to do what you have been doing where you're currently working or how you are practicing at home. But you have to follow the best practice, the golden standards. What have you learned in school? What have you been reading in your textbooks? What have you been studying? What have you been learning during your preparation for your SLA and your CBA? Are you familiar with how it's done in Canadian healthcare? Sometimes when I put IENs in a simulation case scenarios and I ask them, okay, what do you need to do next? Sometimes they would answer me and tell me, this is how I would do it because this is how I usually do it when I'm at the care home or at the hospital where I'm working at right now. Sometimes though, the tendency is, especially new nurses, you pick up nursing practices and habits that are not necessarily safe. But instead, what you need to do is familiarize yourself with the Canadian health standards, learn about the nursing scope of practice, and fill those gaps in between. For example, familiarize yourself with how documentation is done here in Canada, how focus assessments are done, how head-to-toe assessments are done. When do you usually call the doctor? When can you give oxygen? What is the process for medication administrations? Lastly, and this is maybe one of the most important tips, I highly suggest that you film yourself doing case scenarios at home. It's better if you have your patient as your mom and dad who you feel comfortable with. Do a head-to-toe assessment, a focus assessment, do medication administration with them. How would you document your interaction with them and the interventions you have given? Then watch yourself, assess where things are lacking and what can you improve on and what are your strengths. Self-assessment is crucial not only as a student but also as a nurse, as it empowers us to take ownership of our own learning and our own progress. And this will not only help you do well on your assessment but definitely as a nurse. I want to close off by reminding you that during your preparation for your CBA and your SLA and everything you're learning will not only help you do well during your assessment, but these are skills and knowledge that will serve you well once you are practicing in a new environment, in a new country, in a new hospital with different set of nursing standards and healthcare practices. So keep going, you're doing so well and I believe in you. Thank you for watching and I'll see you in the next video.
If you found this video helpful, please support the channel by liking, subscribing, and hitting the bell for future videos. Drop a comment below as well to share your thoughts, ask questions, or suggest any future topics. I would love to connect with you. See you in the next video!